Expressed on this show are those of the host, guest, and callers, and not those of radio station KICK, Vision Communications Incorporated, its management, or advertisers. Vision Communications Incorporated is not responsible for the validity or accuracy of information presented on this program.
Wellness Wednesday with Dr. Norm Shealy and Dr. Shealy-Sorin. Get the health answers you need from the creator of holistic medicine and the 2020 Holistic Doctor of the Year. To be a part of the show, call 417-447-1777. Wellness Wednesday. Now, here are your hosts, Dr. Norm Shealy and Dr. Shealy-Sorin.
And good afternoon. We are getting ready for my favorite holiday of all, July 4th. I have, since I was a child, felt that fireworks are the greatest things ever. And we will be celebrating those this 4th of July. And, of course, as every day, you need certain things. And there are two of them that I particularly recommend. Spring Valley Natural Foods and Nature Blessed Tart Cherries Concentrate. In the produce department at real grocery stores, you find my favorite food and supplement, Nature Blessed Tart Cherries Concentrate. It lowers your cholesterol, it lowers your blood pressure, it's anti-inflammatory, tastes especially good, and 1 ounce, 2 tablespoons is equal to 3.5 servings of the best fruits and vegetables in the world. And of course, to get all of your supplements, you should shop where I do at Spring Valley Natural Foods right there on South Glenstone. You know what I like about it most is service. I really don't know how I would find anything in that store. They have thousands of things. I walk in, they come and say, well, what can I do for you today? What do you need, Doc? And so it's where I shop and you should too. They carry, of course, all of our goodies, it's Shealy-Sorin, vitamins, our multivitamin, Echo Green, our youth formula, our 5 bliss oils, our magnesium lotion, but thousands of other goodies. The premium health food store of the Great Ozarks. And today we're going to talk about vitamin C.
Intravenous, but also ozone intravenous on top of the regular oral therapy.
Interestingly, by the way, I did a survey today, and in the literature, intravenous ozone is much more commonly pushed than regular IV vitamin C. The literature on it is extremely good.
Absolutely. Actually, I've got a little brochure here, and we can actually start with the ozone, talking about ozone, what it is and how it works. So for anyone out there who is curious, what is medical ozone? Let's talk about it. Medical ozone is a gas. It's an O3 molecule. In other words, shouldn't say gas.
Oxygen 3.
It's oxygen 3. Yeah. So there's just the O2 is, in other words, that's your two oxygen molecules. And if you take that and you have a lightning strike, for example, in the atmosphere or otherwise, then what you have in the atmosphere is something called, it breaks in the H2O into another oxygen species, but it breaks off that extra O. And then that joins with another oxygen molecule, water molecule, I should say, that forms a temporary, and this is very important to understand, a very temporary, for a couple of seconds at most. Think of it as a free radical, something that will get to work on whatever is necessary, and it does work on a number of things, including viral infections, bacterial infections, fungal infections, but not just infections. If there's ever an immune issue, such as autoimmune disease, it will help normalize that. If there is a low immune response, unable to fight infections and other things, or immune deficiency, it brings that up. So
it improves it.
It improves it, yeah. So basically what it is normalization. A few other things of interest. Now, inflammation gets decreased. Microcirculation is increased. Now, there's a lot to mention here. I just want to cover some of the essentials here. There is also ultraviolet in addition to the ozone, and that combination has been used for quite a while. Now, ozone itself as a medical modality has been used for over 90 years. Over 90 years. Isn't that amazing?
Well, I love it. I've always liked the smell of ozone. There's certain devices that produce ozone in the room.
Oh, yeah.
And I love to smell them.
Actually, I just came back from an ozone treatment. I
Right,
feel
I
like
know.
$1 million right now. Usually gives you a lot of energy. And the way that we utilize ozone, especially intravenous ozone, is, well, blood. There's several ways actually. Let's kind of cover some of the ozone pathways. You can do it topically. For example, we've saved several people from diabetic ulcers and basically amputations that weren't necessary because of the treatment with the topical ozone, but also for wound healing. In addition, there's other things. Somebody has an upper respiratory, sinuses or ears or otherwise issues. You can always give it topically through the ears, a reverse stethoscope, or nose. Believe it or not, it's actually safe and effective if it's done properly. And it works much faster and much better than any antibiotic that I can think of in terms of those types of infections and issues, also chronic allergies. But I think the concept and the idea is just a wonderful modality. And
Totally. And, to me, it's one of the greatest inventions of the last 5,000 years.
One off, absolutely. But there's quite a few great inventions, but this is definitely on top of the game there. Now, there's also ultraviolet, which is another machine which we use as let's talk about blood ozone, because that's another stronger, more powerful modality. And there's a standard ozone, and then there's a high dose ozone. And the high dose ozone is actually about 10 times more powerful than the standard. But we generally don't start people on the high dose until we make sure that they're safe on the standard. The first and foremost, and we still maintain this, by the way, do no harm. That's our principle number one. Do no harm, which is more than I can say for pretty much most drugs and some procedures out there.
Well, I just wrote a blog on 50,000 drugs that are harmful and cause loss of memory, among other things.
So ultraviolet is real safe. So basically, if I were to describe to you what happened to me just before I got here with the ozone, so it's intravenous IV, and then blood is collected, and for high dose we use a certain pump, so something that blood pump, so to speak, so it does the job more effectively.
It takes it out of your arm into a sterile bag.
And
then the ozone is added, and then it comes back through the ultraviolet to add an extra boost.
Exactly. And the benefit is absolutely fantastic. If anyone has anything to clean up in terms of blood, autoimmune, but anything with general wellness, energy, fatigue, I mean, you name it. It's just one of my favorite modalities, and it takes less than an hour, especially since we've been doing it for about 2 or 3 years now. We've been doing the ozone for longer than that, but the intravenous ozone we started a little later. And so basically, the concept, and I just like to cover a couple of things. So top categories of where ozone and ultraviolet therapy works best, just for anyone who is curious out there. Number one, allergies. We have a lot of folks with allergies, and it's the allergy season right now. I see a lot of that. Autoimmune conditions, bacterial things. Now, I'm not supposed to say this out loud, but it has been shown to help with cancer. Now, I cannot say that we treat cancer out loud.
It's an adjunct.
It's an adjunct. We boost the immune system. So if you can read between the lines, that's I'm just going to leave it at that. But also, I'm just going to repeat a couple of things: fatigue, circulation, cardiovascular, inflammation, joint pain. One of my favorite categories for ozone and vitamin C, and we'll come back to that, vitamin C, because there's a lot about vitamin C, is Lyme disease, Epstein-Barr virus, and those are terrible. Those can actually affect pretty much any organ system, including brain and central.
And
fibromyalgia, chronic fatigue. So the summary on that is basically 90 years plus of use in medical industry, using basically pure oxygen, not nitrogen, which makes it safe. And thousands of studies, safe and effective. Actually, it's been used more in other countries, and there's many protocols, including Russia and South America. It's almost like every other country is way ahead of the United States in this modality.
Well, interesting. We are number 38 in the world in health as a country. There are 37 countries better than we are.
And that's for all the spending on healthcare that we got
right.
in mind there. So that's something to think about. And this is, I just want to jump in a little bit into the concept of holistic. But the idea of holistic really means our definition is it's okay to pay attention to the conventional. It's not all bad. Diagnosis is good. Some treatments is good, especially acute care. I do emergency room work. I do well for most people in that. But when it comes to chronic, and when it comes to those things that are basically getting Band-Aids without getting better, you've got to think of better options.
In fact, in my opinion, chronic drugs of all kinds only make you worse.
Exactly.
They never, ever cure. Holism can cure.
Exactly. Let's go back to vitamin C.
Yes. Now, that's
Intravenous
something
vitamin
we've been
C.
using for almost 50 years at our clinic. And it is my favorite all-time remedy for an acute feeling of a virus coming on, and as well, just to boost energy, period.
Yep. If I may read a couple of very interesting observations, and we actually spent some time on, was it Google Scholar that this came from, this article? When we did the research on vitamin C last couple of days, the article that you pulled up about the effects and mechanism of vitamin C, because that was fascinating.
Well, yeah, I mean, it's good in every possible way.
So, including, it's an essential micronutrient, lots of functions, and it's a very strong antioxidant. It's a cofactor for a family of biosynthetic and gene regulatory enzymes. As a matter of fact, that's how it works on the immunity to a large degree. Contributes to immune defense by supporting various cellular functions of the both innate and adaptive immune system. So it covers not just the, it'll cover things like, what happens with cancer? Well, part of the problem with cancer is the natural immunity fails to deal.
I do want to mention my favorite all-time case.
Please do. Yeah.
First person I treated with this, he had cancer of the bladder the size of an orange. In his case, it only took 10 treatments of IV vitamin C. The cancer was gone. His urologist was angry with him and me.
Well, it's lack of income right there. You just took somebody's salary away for a while.
I mean, I was just excited as the patient was.
Oh, yeah. Yeah. Well, that's great. Absolutely.
And of course, it is better for bladder cancer than anything else because it's excreted through the kidneys, so that it washes right over it.
Interestingly, vitamin C is not just good intravenously; it's also good for the skin.
Oh, yes.
Because actually, one of the things it does is it supports the epithelial barrier function against pathogens, and it promotes a healthier response to including accumulating in the phagocytic cells, and in other words, that's the immune components contributing to chemotaxis, phagocytosis, generation of reactive oxygen species, and microbial killing. In other words, the short of it, it really does a great job at getting those bugs, if there's a bug out there. And it doesn't quite differentiate. It doesn't, in other words, whatever you have in your system that's causing your system discomfort or illness, disease, is likely to respond to vitamin C intravenous, but we're talking higher doses. You cannot take those amounts by mouth.
Well, interesting. I think it's worth mentioning that by mouth, the average person cannot tolerate more than about 5 grams of vitamin C orally. Now, if that's regular vitamin C, there is a liposomal fat-soluble vitamin C. And many people can tolerate anywhere between 6 and 10 grams of liposomal vitamin C, but that's not enough. Of course, it was made famous back in the 70s by Linus Pauling when he wrote the book of vitamin C and the common cold. That actually made him more famous than all his physics work.
Interesting. Yeah.
Then he wrote one on cancer later.
Now, did he get into trouble from conventional community?
No, because he's not a physician.
Oh, that's why. Okay, so thank you for clarifying that. Yeah, because generally people who go against establishment, you got to consider where you are on the radar. I'm just saying, can't say too many things out loud. So that's why, reading between the lines is a very wonderful statement here for the segment here. But, the other thing, too, is deficiency of vitamin C. Again, they're just the opposite, is associated with all sorts of illnesses, immune illnesses, the inability to fight pathogens, but also cancers and a lot of other chronic disease, blood pressure, diabetes, and otherwise.
and actually even atherosclerosis.
Even
Good
atherosclerosis.
for blood vessels in the legs as
Yeah.
well as in the heart.
Absolutely. And now, if you hear about vitamin C intravenous, I just want to say, ask very clear questions about for the purpose of the vitamin C and also the amount of vitamin C as well, because it's not just a question of getting vitamin C. Period. I mean, I've seen actually this is where you have to be careful with some providers who do intravenous C, which they claim without giving too much information. So be careful on that. That they'll provide cheaper prices and so on and so forth, but they give very small amount of vitamin C in a pre-mixed solution. And now we looked at that pre-mixed solution. That was pretty terrible, wasn't it?
I wouldn't drink it, let alone put it in my veins.
My vein, exactly. So there's many factors, and especially if you're going to be focusing or working on treating the disease or some kind of a condition, not just getting extra energy, which is you can have less vitamin C for that.
And it must include something called Myers cocktail.
That's right. It's a combination. Yeah. And so basically the Myers cocktails. So let me just jump in on this: calcium, magnesium, B complexes. Lots of other things. And by the way, somebody did ask me a question, one of the patients, why can't I get just vitamin C without anything else? And I answered that question, but do you want to address?
Well, it's just not safe to
Not
get
safe.
that much acid alone, let alone.
That's right.
But you must, the most important part is for your kidneys.
Yes,
You must have an increase, especially in B6,
that's right.
or you can get kidney stones, even orally. If you take more than 100 milligrams, and everybody should, all adults at least,
Yeah.
you must take adequate B6 in order to keep from getting kidney stones.
And that is one of the biggest questions that I get from my colleagues in the conventional world. That it's almost like basically people tend to be fixated on the kidney stones and vitamin C intravenous, but again there is a caveat there.
You give 100 milligrams of vitamin B6, and that'll prevent it.
Exactly. So this comes back to what we talk about definition of ignorance, ignoring the facts. But the short of it, the combination of IV ozone and sometimes what I've been doing lately is I follow it by vitamin C. Again, not on everybody, but some people, some individuals, and maybe it could be a different day. But that combination tends to do incredibly well, extremely well, because the ozone will clean up the blood, and then vitamin C will contribute in a collaborative capacity. So these are wonderful modalities in terms of the immune system. But I do want to mention that on an everyday, regular basis, do you want to go over some of the basic supplements in general that people should be taking as well?
Well, I think all adults need now 25 milligrams of B complex, which they will find in the Shealy-Sorin Eco Green Essentials.
Mm-hmm.
It's my favorite multivitamin. And by the way, folks, if you don't take about 25 milligrams of B complex, your memory is going to go about 10 to 20 years earlier than it would as long as you take them.
Mm-hmm.
It's the most essential of all. The second, of course, is the Shealy-Sorin Youth Formula, and it is the only one that I know on the market, which includes 2 grams of vitamin C and 1 gram of MSM. Either one of those alone can be useful, but they don't increase your telomere growth, and they don't increase your anti-stress hormone DHEA unless they combine. 2 grams vitamin C, 1 gram MSM. It's the combination that is ideal for your health.
Wonderful. Also, and by the way, there's a special on that package that's available. I was going to wait until later, but this is just a wonderful opportunity to introduce this. And we'll talk about some of the other supplements. But there is actually, for the 4th of July, we'd like to offer a possibility of 15% off everything in the store for the basically everything in the store for the holiday, 4th of July. And the code is July, as in month, 2021. So if you're interested in that, I think it's a wonderful opportunity to start with your immune system and
stock up for the next 6 months.
Because we don't know what's going to happen. We've ran out of a couple of things already a few times, and we had to find alternative sources.
Right.
well, something is happening out there, but make sure that you're okay. Make sure you have what you need for your immune system and your general health. There's also, just interestingly enough, we have talked a lot about the PEMF device, and also we talked about a scalar device, and both of those as well are available. And I'll say this, for those who are interested, at a sale at a discount, with a PEMF off $240. For the
That's even better than the last one.
I know, but it wouldn't last very long. But I mean, it's just that I did want to mention it. And there's something called a scalar device, which is reduces free radicals and also contributes to in many ways to health and wellness. And that item as well is going to be off for the holiday for $150 off again. So that is a wonderful opportunity for anybody who's been waiting to get into health and wellness and to get started with some things that are helpful to get started.
It's our fireworks sale.
It's our fireworks sale. Exactly. Yeah. So, but let's, we still have a couple of minutes. So let's talk about some of the other things that are essential. So vitamin D3.
Well, of course, in adults, if you weigh 140 pounds or more, 50,000 units of D3 once a week. And if you weigh under that, the 1st, 10th, and 20th of every month. Mm-hmm. This alone is the single most important thing for your immune system. All of them are good, but D3 is absolutely essential for life almost. Mm-hmm. And let's not forget astaxanthin.
Yes.
Now, that's a very interesting one. Astaxanthin is related to, chemically, beta-carotene, but it does not make vitamin A in your body, but it has all kinds of antioxidant effects. It is a superb enhancer of health.
And I would also recommend for anyone who wants to optimize the immune system on a daily basis, beta-1,3-glucan.
Absolutely. 500 milligrams of that can also enhance your immune system overall. And, of course, don't forget one of the most important things in the world. I have this question comes up to me so often about cataracts. Mm-hmm. Some patient I was on the phone with yesterday scheduled for cataract surgery in August. I said, well, it's a little late to be trying it now, but I would postpone it for 6 months at least and use castor oil, USP castor oil in your eye once a day for that 6 months and see whether you may not need surgery.
It's interesting. Our online, when you look at what happens on the website and the questions that people ask more about the castor oil and the eyes than they do about the heart, about the lungs, about anything else. It's kind of fascinating. Most common questions that we're getting.
And, of course, my other favorite is castor oil packs over the abdomen to detoxify the body. A cloth soaked in castor oil, a piece of plastic, a towel, and a heating pad for 1 hour every night is phenomenal for detoxifying the whole body, especially the liver and the gut.
Absolutely.
So the health is an inside job, and you are responsible. I can't do it for you. I can't breathe for you. I can't eat for you. I can't sleep for you, but I can advise you optimal, safe alternatives for your health. And that's holism.
Perfect. The other thing that one of my other expressions that I like very much, and I'm getting even more fond of it, is along the same lines, basically. In other words, you can lead the horse to water, but you can't make it drink. In other words, we can provide all sorts of information, guidance, advice, and suggestions, but it's up to the individual to see if they're worthy and if they're willing to take care of their health and wellness. And of course, it all starts with a lifestyle. And then, of course, there's mental and emotional. Now, we typically talk about autogenic training, which is one of the best self-regulation systems. And we're almost at the half-hour mark. So I just want to mention one more time. But if there is a need for immune system boost, vitamin C IV and ozone IV, one of the best modalities, and we're happy to offer that in our clinic.
And don't forget the July 4th sale.
That's right.
50% off on everything.
15.
15% off on everything in our store.
Yes.
And specials on Pamphlet and Taylor.
Yep.
Yours for the happy 4th of July. Okay, any questions?
Or comments or thoughts?
Yeah, Helene had a question. She was asking if you could tell the listeners a little bit more about the colloidal gold that you mentioned in your email.
Colloidal gold. Let's talk about colloidal gold and what it does.
Ozone. Colloidal Gold.
Now, go ahead.
Well, everybody knows about colloidal silver, but colloidal gold has been around even longer than colloidal silver, I think, and it is excellent for your immune system, for intuition, it's just a salve, if you will, for the entire metabolic system.
Absolutely.
One of my favorites.
And among the aspects of the immune system, there's also as an adjunct or another agent to help with things like cancer.
Yes.
And things of that nature.
No question.
Yeah. That's great. Thank you, Helene. What else we got?
Yep, we have a question. One of your listeners has a rash that's developed with a lot of rain and humidity in the groin area and under the bra. I'm wondering what you would recommend for that.
So under the bra and the groin area, most likely, depending on what the condition and what it looks like, it's hard to say what the rashes are, but it's usually fungus. It's usually fungal overgrowth, and if you conventionally, if that's what it is, of course, that would be treated with an antifungal agent like difluconazole or something of that nature. But thinking of other options, non-drug related, I've treated that with a topical ozone with great results.
But also Nixol. The spray
But
of
also
Nixol
Nixol
could be useful.
Yeah, absolutely.
Definitely
That's hypochlorous acid. It sounds terrible. It sounds like an acid, but it's actually very safe. I've sprayed it in my eyes, my nose, my mouth, and it's wonderful. Even it tastes good. But yeah.
All right. We had another question. This one was about. Let me find it.
Mm-hmm.
Okay. You've mentioned on past shows something that you can use to take away your craving for sugar. What was that?
Gymnema. Gymnema handles the sugar cravings.
Gymnema sylvestre. Actually, just take a few grains of it out of the capsule, not the whole capsule. Just put a little bit of the powder on your tongue. You won't be able to taste sweet for 4 hours. And if you start taking then one capsule once or twice a day, within a week you can lose your craving for sugar.
Actually, Dr. Shealy did something. I remember we were having dinner, and you made that experiment with me. I couldn't enjoy the rest of the dinner. It was terrible. But it's okay. It was good,
And there was no sugar in the dinner.
And oh God,
I haven't had sugar in my house since 1970. I haven't bought a
bag
of sugar in the house since 1970.
Your house is pretty secure against those things in general. But that's what they say to people too. It's like, don't bring it into the house, and then it won't be a problem. Anybody else?
Let me see here. All right. Somebody asking about help with anxiety for a 13-year-old.
Anxiety in a 13-year-old.
Actually, there are two major things for anxiety. Autogenic training. But magnesium lotion can help, and my favorite of all, L-taurine. The amino acid L-taurine is wonderful for that. Now, if it's bad enough, then the best treatment in the world, better than every psychotropic drug in the world and all psychiatrists combined, is a gamma PEMF device.
Minimum 2 hours in the head over a baseball cap, and it literally places the brain into gamma. Gamma is the optimal brain state. It's a wonderful place to be.
It's the greatest thing in the world for brain of any kind.
Mm-hmm.
All right, we've got about 45 seconds until we're back on.
Well, folks, let's think about your health. Are you one of the 2.5% Americans who have all good health habits? 97.5% are missing 1 to 5 of those habits. That is, no smoking, of course, a body mass index of 18 to 24, eating a minimum of 5 servings of fruits and vegetables a day and up to 8 or 10, exercising 30 minutes 4 days a week minimum, preferably 5, and sleeping 7 or 8 hours every night. Those are essential for health. If you don't do those things, you ain't going to be healthy. There's no way of being healthy and missing any one or more of those habits.
And that's a foundation.
That's the foundation.
Now, back to Wellness Wednesday with Dr. Norm Shealy and Dr. Shealy-Sorin.
So now we are Now we are ready for your questions at 417-447-1777. Ask us anything because it's all related to your health. So good afternoon. You're on the air.
Hello.
Hello.
Hi. What's up?
I wanted to ask how often the ozone IV should happen for people with like joint inflammation, sinuses, allergies, not the Lyme disease or that. But
I believe for sinuses, for allergies, not for the more serious or heavier stuff like Lyme or Epstein-Barr or otherwise. That can be anywhere from weekly to every couple of weeks, and it usually does well. Does very well, as a matter of fact. But it depends. Sometimes you may need to jumpstart a little bit more often, and then you can kind of space it out to even once a month when you're stable or when you're doing better. Thank you for asking.
Okay.
That's wonderful. Yeah.
Thank you.
Oh.
And can when you two talk about the sapphire pouch, you talk about calcium being reduced in both your bodies.
Exactly.
Could you explain to the layperson what that means?
Well, the biggest problem with calcium deposits is in the arteries in general, but in the arteries to your heart or to your brain. But if you wear one of the sapphire pouches over your heart, on your chest, within a year, it can begin the process of decalcifying your heart. It's a bypass for bypass surgery.
And yes, and to kind of refresh.
And it's safe.
And it's safe. And at the time when I did this personally, my calcium score came down about 200 points, and I had 201, so I had 1 point left. Almost like a newborn baby. Almost. But not quite. Yeah. I'm sure I accumulated some calcium in the last year or so with all the stress here of life. But it'd be interesting to see what that shows them. But yeah, great question. Thank you. Yeah.
Thank you very much. Have a good day.
Yeah, pleasure. Yeah.
And good afternoon. You're on the air.
Yes, I was wanting information on interstitial cystitis. If you have any recommendations for treatment for that.
Interstitial cystitis.
Actually,
interstitial cystitis, yes.
DMSO, irrigations of the bladder. Mm-hmm. It's one of the few good things your FDA, the Federal Death Administration, ever allowed. They don't allow it on the skin or any other way, but they do recommend it, and I recommend it strongly. You see a urologist who does DMSO irrigations of the bladder. Yes.
Mm-hmm.
ENSO.
D as in David, M.
As in Mary. S as in Sam.
O
as in Oregon.
Yeah.
Okay. Thank you very much.
Hey, thanks for calling.
Mm-hmm.
And now it's your turn. You can ask any question because it's all related to your health. 417-447-1777. Otherwise, we will continue talking about, well, I think not just ozone and vitamin C IV, but the 4th of July special.
Ah, yes, of course.
It is your time to get all of our things 15% off for this very short period of time.
Yes.
The fireworks sale.
And including the PEMF discount of $240 and Scalar discount of $150. So basically, this is a wonderful opportunity. Now, I've got a Scalar in every room of my house, literally. No, but I kind of like the free radical reduction in the office as well.
I do too. And I sit with one all day at my desk when I'm at the office, and I sleep with one all night at me when I'm sleepy. And it does not just reduce free radicals. Interestingly, it has, in many people, reduced the amount of gray hair by 50%.
Oh, yeah.
I don't care about gray hair one way or the other.
Well,
good afternoon. You're on the air.
Oh, Dr. Shealy and Dr. Sergio.
Hello, Big Bob.
The Ozarks Jubilee. I've got someone very, very close to me. I'm sure this applies to tens of thousands of others that is being bothered with beginning dementia or Alzheimer's.
Yep, beginning. Yeah, Bob, I'm just gonna. There's a little static here. I'm just gonna repeat so that we can all hear proper. Yeah, dementia and Alzheimer's. Yep.
The greatest thing in the world is he must have our essentials, our youth formula, and the cranial PIMP device. I have a man who could not speak. He was so bad with Alzheimer's. And he is now perfectly great from using the gamma pimp device.
So is that something they come into your office, or do you buy that cranial thing?
Well, I would like to see that patient in advance, but they have to take it home.
I see. Okay, well, I'll work on that. And I know you've worked miracles in many other people's lives, so I just want to thank you both and wish you a very happy, prosperous 4th of July. And thank God for Old Glory.
Amen.
Thank you, Bob.
Amen. Thank you. Yeah.
That was one of the noisiest ones I've ever heard.
Well, good conversation, though. Yeah. Yeah.
And, folks, the question is, what does it take for you to take care of yourself?
Mm-hmm.
It's that simple. And you can. I mean, you have the mechanism, you have the power, and nothing is more important than your own health. Your job is not as important, your family is not important, because if you're not well, you can't do what you came to do, which is help those things.
You know, I'll tell you, when I had that car accident, the car wreck, I'll talk until we have a caller. Just in short, when the car landed, it was a pretty terrible accident. I ended up with a lumbar fracture and all that stuff. So pretty significant mechanism. But, one thing that was when I landed, I wasn't even sure I was alive. I was just looking around. I was looking at the trees and I was asking myself, is this what heaven or hell like? I mean, it's like, where am I? But then ultimately I figured out the back started hurting. So it's like, I got to be here on earth still, so. But, one thing that came through, and this is very powerful, I'll share this, is, first of all, how many of us, including myself, especially myself, take chances. We play games with our life. We take risks, unnecessary risks, whether it's doing something or not doing something when something is indicated. That's a risk too. Action is a risk. Inaction is a risk, especially if you know something needs to be addressed or should be addressed. And last but not least, life is a gift. Life is a gift. And without health, without wellness, I mean, Norm, you're absolutely right. When I was looking and thinking about all the things about work, the hospitals, all the accomplishments, all the pictures on the walls, and all
family.
That's what matters, really. It's the family, it's the friends, and it's the things that we close to the heart. I mean, that's ultimately what matters.
Let's talk about your responsibility. That is being conscientious.
Yeah.
Conscientious makes that you are responsible and you take care of yourself. Good afternoon. You're on the air.
Yeah. Well, I'd like you to comment, please, on the COVID medicines. They're recommending one that I give my dog for heartworms on a regular basis, but I didn't know you could give it to humans.
Which one are you talking about? Which
the ivermectin?
Yeah, there's a human dose. There's a human factor. I work with that in the office.
Okay, I've never seen it and haven't ever heard anything about it until all this COVID crap came up.
Mm-hmm. Yeah, if you call
is it anti-helminths as well?
Yeah. And it's anti-inflammatory and many other functions. If you call the office, if you want, of course, I'm happy to help you with that.
I do want to mention how personally I prefer IV vitamin C.
Well, that's one way. But there is a medicine as well. Yeah, you got it.
I just hadn't heard about it before. Like I said, I've used it with my dogs for years, and I didn't realize it was available for humans.
Yes, absolutely. I'll share one thing. Lately, dogs are getting better care than humans are in everything. That's crazy.
I know mine do.
Yeah. Yes, sir. Yeah, I would love to hear from you. And the number, the contact to the clinic. And do you want me to give you the contact? It's 417-351-5221. 417-351-5221 if you're interested in talking, but there's also several protocols that work very well, and we can talk about those.
Cool. Thank you.
My pleasure. Absolutely.
Thanks for calling. And now is your turn, 417-447-1777.
Mm-hmm. So you were actually on a very, very good topic, personal responsibility and conscientiousness. Let's continue on that, because that is worthy.
The book, The Longevity Project, in April 19th, 2009 came out. 2011, April 19th. At any rate, they studied 1,500 school kids from 1921 until 1980, one of the longest scientific studies in history. And they found that the more conscientious you were, the longer you lived, the healthier you lived, and the more money you made throughout life.
Which makes sense.
Nothing more important, except right after that is having a network of friends. Now, they did define what a network of friends is, but to me, it's 3 or more. And those two things, if you are responsible, it means you've got good health habits, and you have a network of friends with whom you communicate regularly in some kind of way, then you're likely to outlive the average American by up to 20 years.
And of course, there's the entire cascade of holistic options and alternatives. And again, I just want to bring out this concept of holism. Holism doesn't mean disregarding the conventional. There is a use and a purpose to it, but in the right capacity, not for everything. We almost had a caller. I hope they call back. Yeah.
We got one blink.
Yeah. Well, let's see if we can get you back here on the line, perhaps. Any questions on the?
Yeah, we did have a question about with the Echo Green. Is it okay to take that with a dose of CBD if they're
Yes, with CBD, absolutely. Yeah, actually, CBD is a wonderful modality. It has so many beneficial effects on the endocannabinoid system, and it's perfectly legal in the state of Missouri. So yeah, it works very well. Yeah.
Good afternoon. You're on the air.
Hi, Dr. Shealy and Dr. Sorin.
Hello.
I was calling actually a friend of mine that's a professional bodybuilder.
Mm-hmm.
He's had a horrible time with, I think they're called calcinoids.
Okay, so say that one more time.
The calcinoids, they're the calcium buildup that form little nodules of bone throughout his muscles.
Okay, the chances are he's very deficient in magnesium.
Mm-hmm.
Okay, deficient in magnesium.
Yeah.
Well, he needs magnesium lotion.
Right. I'm familiar with that.
Yeah.
And they've actually had to remove these by surgery repeatedly in his shoulders, and now the most recent one in his bicep. Which is just, I mean, he's had a horrible time with this. He's had like 4 or 5 different surgeries from it.
I would probably wrap my arm with a Castor Oil pack all night as well.
Yes.
Okay. So is there anything he can take to stop them from forming?
Well, again, he needs to be careful about taking too much calcium.
Right.
I mean, if he's on vitamin D3, he doesn't need any added calcium as a supplement. But he does need magnesium lotion. In his case, he needs about 4 teaspoons twice a day.
Mm-hmm.
Or topically, of course.
Yes, of course.
Okay.
Mm-hmm.
All right. Well, I really, really appreciate it. He's just had a horrible time, and he's about given up. He wants to he's just horribly depressed from it because he can't even lift now.
That's right.
So,
I got you. Yeah, I think.
And if it's local pain, is he a local person? Is he in Springfield?
No, he's all the way out in Texas.
Oh, Texas.
Unfortunately.
I'm sorry, my dog heard you guys on speakerphone.
Yeah.
He's all the way out in Texas, and I've asked him to call you guys. He just doesn't think there's any hope, and he just keeps having this surgery.
Well, if you can get him to watch the recording or the information, there is hope. There's absolutely hope, and there's actually other things.
That. He's just withering away and doesn't even see his own self the same now that he's not able to lift it all anymore.
Yeah. Well, this is where...
You guys. And, hey, how long is your sale going to be going on?
Oh, sale?
For the scalar and your other device?
Yeah, I believe it's the 4th of July now.
Midnight on the 4th, I think.
Okay, and lastly, have you heard of the spooky device that's supposed to be like a scalar?
What's the name of the device again?
It's called Spooky.
Spooky?
I don't know.
It's supposed to be like the Tesla version of the scalar device to help eradicate any kind of irregular cells and such.
I've heard the name actually.
I don't know.
I haven't played with this device personally, so to speak. But I'm not discounting that it may be good. I just don't know. Sorry.
Right. Well, I'm just trying to determine what would be the best for any kind of.
Yeah.
But like in your scalar device, does it work to help eradicate irregular cells, so to speak?
Scalar will reduce free radicals. It will do a number of other positive, healing functions. But I'm not entirely sure scalar alone is going to take care of that issue.
It does.
Okay.
It
All right.
does
Well,
help.
I've got to get back in and get my IVC. This is Diane. I'm long overdue for some.
Oh, absolutely. And by the way, vitamin C is one of the best things all around for wellness, for health, not just for illness.
Right. I'm
yeah.
aware of that. I've just got
Mhm.
I've got the cancer type of circumstance, and I know that's
so you
wonderful
better.
for that.
Yeah, this is where we normally, again, as a support, we use ozone and vitamin C. So
Right. And
Yeah.
out of curiosity, if you don't have another second with that, how does the ozone assist with helping eradicate those irregular cells?
Ozone will actually detect, break down, and present to the rest of the immune system the atypical, the pathogens, and all sorts of stuff. And it does wonderful by helping, assisting the vitamin C to do its job as well.
Okay, so the two together actually is better then.
Wonderful.
Okay, thank you so much. I'll let somebody else call.
Thank you so much,
guys.
ma'am. Yeah. Mhm.
Anne, good afternoon. You're on the air.
Yes, good afternoon, doctors. I have a question. I'm
Hi.
78 years old.
78.
And have just 78, have just recently been diagnosed with stage 3A chronic kidney disease.
Stage
And I
3A,
have been-
chronic kidney disease. Gotcha. Yeah.
And I have been prescribed 25 milligrams of losartan.
Okay.
My question is there something I can do besides the drug?
Yes, absolutely.
Okay.
My favorite would be L-taurine, the amino acid L-taurine.
Okay.
How much do you weigh?
Well, I'm in the process of losing weight. Right now I weigh just about 180.
Then you need 4,000 milligrams a day, up to 6,000 milligrams a day. I would start with 4,000 milligrams of L-taurine spread out over the day, and
Okay.
after a week, up it to 6.
Mm-hmm.
And be sure you're getting at least something similar or equal to our Echo Green multivitamin and the vitamin C.
Mm-hmm.
Okay. I am taking vitamin C every day.
Yeah, but you need a B complex as well.
Okay. I'm not doing that. Okay.
Well, you need, in your case, I think you need 50 milligrams of B complex a day.
Mm-hmm.
50 milligrams. Okay. And how much vitamin C should I have?
2,000 milligrams.
2,000. Okay.
No, that's oral. That's by mouth, and that's
Right.
the minimum amount. I mean, obviously, can do more, but it also some people have hard time tolerating large amounts by mouth. That's why when we need to give higher amounts of vitamin C, that's why we go to intravenous treatments.
Sure. Okay. And what is the Echo Green? I'm not familiar with that.
That's our multivitamin B complex, and
Oh.
you know,
Okay.
it's not just B complex. It's got traces of all the things you need.
Okay. Okay. And can I get the L-taurine? Can I get that at Spring Valley?
You can also look on normshealy.shop, by the way. And
Okay.
if you normshealy.shop, and I think that's what that is, or realholisticdoc.com. You can get there to the store there, and there is a sale, by the way, if you're interested in making this happen. There is a 15% off everything. So not to tell you what to do, but if we're going to get something, this is a good time.
Very good. Now, is there a way to actually reverse the kidney disease, or will this just to help to stabilize it, or how does that work?
You know, I would like to say that maybe PEMF might
I would certainly try it.
Mm-hmm.
The PEMF one, I'd sleep with it on my belly near the, sort of near the kidneys.
It's all about cellular function. It's all about regeneration circulation, and PEMF optimizes things on a cellular level. Trillions of cells. It's literally recharging the entire body. So if it makes the organ work better, function better, look better, feel better, then that's the goal.
Okay, very good.
Every 7 years, by the way, I'll say this out loud, it's every 7 years the body generally regenerates. So if you change the patterns for the better lifestyle, but also, and again, if what we normally do with our clients, so we make sure that your lifestyle, your foundation is solid, or it's getting better. We want to optimize, certain supplements and things like that are good for you specifically, and that'd be worthwhile. But also some of the things that we talked about, and
here's a place where I would also recommend Water Bliss.
Okay. Yeah.
For aldosterone regulation.
Yeah. Water Bliss. Do you want to talk a little bit about the Bliss oils? Just a very brief summary. Yeah.
Well, there are 5 of them, and they are a substitute for acupuncture. You don't have to come into the office once a week to get acupuncture. You could do it at home. And it only takes you about 30 seconds to do one of the circuits, which could have taken an hour of acupuncture. And fire raises DHEA, air raises oxytocin, water normalizes aldosterone, and that could help with your kidney function. And, of course, earth raises calcitonin, and crystal reduces free radicals a whopping 80%.
But personally, I take all 5, and the combination of the 3, it takes 30 seconds for each ring, each circuit. It's actually pretty amazing. And it actually smells good. It's my perfume for the day, literally. I haven't had any complaints yet.
Very good. Okay. I appreciate your help so much. I'm just wanting to, I take no prescription drugs, and I just do not want to start now. So
then
I just wanted to see what I could do besides that.
Oh, you can do a lot. It's wonderful. Yeah.
Okay. Very good.
But we'd love
Thank
to hear
you so
from
much.
Yeah, pleasure. Yeah, absolutely. Yeah.
Bye-bye.
Bye.
So the bottom line is you can do more for your health than all the physicians in the world if you take care of yourself.
Mm-hmm. And let's just summarize briefly. We got about a couple of minutes to go, so we can talk or we can take a call. Well, actually, there's a call right there. How's
Good
that?
afternoon.
Yeah.
You're on the air.
Hi.
Hi.
What can we help you with?
Well, what I'm looking at is I was just making some notes on what you guys were saying, and the castor oil in the eye, is that like organic castor oil you just drop in your eye?
It's USB.
No. It doesn't matter. It must be United States Pharmacopoeia, the kind you buy at a drugstore.
Mm-hmm.
Okay. All right. And because I had not heard of that. I'm sorry?
We do carry it on our website, but you can get it at a drugstore.
Oh, okay. And then was it B as in boy 6 that you were talking about for kidney stones?
Preventing kidney stones.
Most kidney stones are calcium oxalate, and 90% of them. And those are the ones that are caused if you don't get adequate B6 when you're in your diet.
But here's the thing. If you're going to be taking vitamin B, you want to make sure that all the other Bs are okay.
Exactly.
So that's why Dr. Shealy-Sorin Essentials or Eco Greens is basically, it's got plenty of B complex in addition to minerals, and it goes together with vitamin C, raises DHEA, dehydroepiandrogenase. So it's a win-win.
Okay. So if I'm taking the green now, then I'm getting that B6 in that, enough of it?
Well, how much do you weigh?
Mm-hmm.
I weigh 150, and I take 2 a day.
I think you should take 4 a day in your case.
Mm-hmm.
Okay. All right.
That would give you adequate, yes.
And may help with the brain functions too, memory and all the other stuff. It's just wonderful.
Okay, and one other question. Topical ozone.
Yes.
That, how do you get that? What is that? I'm
not
sure.
It's the application of ozone to either arm, leg, skin, or even it could be ears, mouth, nose. Basically, it's not involving the blood, collecting the blood, or working with the blood. Blood is the most powerful, but topical is fantastic.
Okay, terrific. Thank you so much to the both of you.
Thank you.
And everyone, happy 4th of July. Enjoy.
And I think we are good. Any questions? Anything else to finalize?
I was just looking to see if there's anything else that. This one's more of a technical question, but somebody's having trouble charging their PEMF device.
Charging PEMF device.
Yeah, they said they can use it while it's plugged in, but they have trouble charging it.
Ah.
Any advice where they could look for help on that?
I think if there's a question on the charge on PEMF, send it back to the store.
And we'll check it out.
And we'll check it out and make sure it's working proper. And if it needs to be replaced for whatever reason, then we, again, depending on how long the PEMF has been there and otherwise, there's several ways about it. But we'll make sure that you're okay. Yeah.
That's all we had. We covered most of the other ones already.
Well, so how about just a simple paragraph just to summarize some basic essential things. Lifestyle, number 1, is a foundation. Mental, emotional, physical. a holistic approach,
autogenic training,
biogenics,
and of course, adequate nutrients like our Oric Green Essentials and our Youth Formula and vitamin D3 and magnesium lotion.
And of course, there's other uses for other supplements, but there is also a place for intravenous treatment, and that's what we talked about today.
Vitamin C and ozone.
Well, hope you found this educational, and look forward to connecting with you next Wednesday.